So once again, welcome to Samir Cottage. Today we will discuss mostly about the application point of view. So what are the application zones of biomaterials? So according to the system, we have classified into the mostly in 4 to 5 classes. So first is the musculoskeleton system. Next is dental. Another is cardiovascular. Another is organ and skin based, and lastly we can categorize into the sensor based or microfluidic sensor based biomaterials. So biomaterials are applied basis on their properties, such that physical, chemical as well as mechanical, and in that uh, categorization of the biomaterials we are applied into the different application zone. So first come to the musculoskeleton parts. So this is basically the load bearing zone. So hip prosthesis, fingers, knees, nails, bone plates are comes under this consideration. Next come to the cardiovascular part. So regarding cardiovascular parts, we have used pacemakers, stent, arteries, heart valve, and so on, so on. And comes to the another organal organs, so like skin, breast, kidney, artificial heart, and urinary tract. Comes to the sensor part. So sensor based is the cochlear or the intraocular lenses we are using mostly. Next come to the dental job. For dental part we are basically used as a teeth implant. So teeth implant are the two kinds, so for aesthetic view and sometimes for the failure of the teeth in any sections, or the or the teeth are not, when teeth are not in the proper position. So also we are going for dental fixtures also. So also the skull plates, hooks, orthopedic parts are the parts of the dental implants as well. And the others are like artificial nails, as well as some plaster and statues and catheters we are used biomaterials. So first come to the musculoskeletal biomaterial application of the musculoskeletal uh, in the respect to the biomaterials part. So biomaterials, those are used for musculoskeletal system. So first is the hip prosthesis, next finger, next hip, and so on, so on. So we are briefly describe those things in our upcoming parts. So basically in comes to the hip replacement. So in case of hip replacement, we are going through the total hip replacement, or sometimes we are going through partial hip replacement or the half hip replacement. So this hip replacement is also known as orthoplasty. So orthoplasty is a constructive surgery to restore the joint motion and function and relieve us from pain. So this is what I previously mentioned. This is two kinds: total hip replacement or half replacement. So in case of half replacement, only femur heads is generally replaced, and in case of total replacement, we will replace both the acetabulum and the femur heads. So principle and consideration what we take into mind in case of musculoskeleton or load bearing musculoskeleton uh, based uh, musculoskeleton based hip replacement. So the principle and the consideration what we taken care, the prosthesis implant must be durable. They must permit extraordinary flow, friction or low movements at the articulation. They must be firmly fixed with the skeleton. They must be inert, not provoked to any unwanted reaction with the tissue. So basically they should not create uh, uh, undesirable mineralized uh, thing in case in our body fluid. And the prostheses are various design. So the design based on the various design, we have to taken care of the biomaterials. We have to taken care that which kind of biomaterials we use. So in case of load bearing application, we are basically going through the mechanical strength of the biomaterial. So in that base we can use hydroxyapatite as well as bioglass. In case of hydroxyapatite, we are also going through the micro or nano level. So we have to take care those what kind of biomaterial we use. that is based on the various design of the prosthesis. Next is the sectional section of the prosthesis and fixation techniques depends on the patient's bone structure. Orthoplasty is an extracting and the meticulous procedure to reduce the risk of infected prosthesis. Special precautions are carried out in the OT room to reduce the particular matter and bacterial count of the air. So orthoplasty, in case of, we can also say hip prosthesis, is very much exacting and meticulous procedure. So we have to keep in mind that there is no such kind of infection will take in place while we are implant it into the body. So what do you mean by implant? So implant, basically here we are talking about the hip implant. So in case of hip implant, there are three parts. So one is acetabulum curve, another is femurous component, another is articulars interface. So now comes to the the prosthesis implant used in the hip replacement consist of those three parts. Now we are coming to that what kind of material we are use here. So based on that, so acetabulum curve mostly made up of metallic or metal based biomaterials, or metallic biomaterials we are basically using. And in case of, or sometimes we are going through the ceramic part also. And in case of humors component, this is also maybe the biomaterials under the metallic classes, or from it maybe comes from the ceramic class also. And also we here we are basically use two terms. So one is metal on metal, so that acetabulum cum and fumarase both are made up of metal. And also one is ceramic on ceramic, so the both acetabulum cup and fumars component are both made up of ceramic materials. And the articular interface, always we are going through the any kind of soft biomaterials such as any kind of polymer. So basically we can use here PMMA as well. So this is the total scenario of the hip prosthesis. So this is the inter basically articular interface which is made up of soft tissue, and this is the acetabulum cup part, and this is basically the humerus zone. So if we are see it from the city point of view, so this is the basically the screw parts, and the total hip joint is attached with our body in that way. So now comes to the type of implant. So what I have mentioned before, so it may be on metal, or ceramic on ceramic, or maybe it will be based on metal on ceramic as well. Now come to the knee prosthesis part. So in case of knee prosthesis, there is two zone. One is femurs, another is tibia. So in case of and both are connected with a soft polymer materials, so that there should be decrease in the wear between femurs component and the tibial component. So basically that's all for today. uh, Otherwise the video will be too long. So next class we will discuss from the spinal implant. So thank you.